Welcome to MyLITV. From Manhasset to Montauk, we have traveled our communities to bring you the following events. I'm your host, Waldo Cabrera. MyLITV starts now.
I'd like to officially welcome you to Allied's inaugural conference.
Allied Physicians Group is a physician-owned, physician-run, physician-managed medical practice primarily on Long Island. We began in pediatrics about 7 years ago, and now we're branching out to adult primary care. We were sort of at our wits' end in how to deal with regulations and insurance and everything else, and we felt like without working together, we'd end up as an employee. And enough of us have been involved in private practice long enough that we thought there must be a better way.
There's one voice that no one knows. What does the doc say?
We've invited a really great dynamic speaker, Dr. Zubin Damania, coming here from Las Vegas. He's trained as an internist, worked as a hospitalist, and now has started his own group in Las Vegas to try and get the physicians closer to the patients.
It's the hard doc's life for us. Too many patients for each of us.
So Allied, being very pediatrics oriented, had watched one of my videos on YouTube called Immunize, and it was a video about vaccine denial and how sort of celebrities in the popular press have been demonizing vaccines for a long time, even though they're the safest, most effective thing we have in all of medicine. So I made a parody video about this that kind of ridiculed some famous celebrities who've been anti-vaccine.
These ain't the kind of shots that killed Tupac. They put the brakes on polio so little kids could walk.
They said, well, this might be an interesting character to talk to our guys. And I think what it says about them is that they're a little more adventurous. They want to try to poke people a bit in the nose and challenge conventions and norms, and so I'm more than happy to try to do that.
Your protocol's all out of date. Blowing air down the pipe is so 2008. So forget about that. Almost squeeze the chest. CPR hands only when your homie arrests.
I was a hospital doctor at Stanford Hospital for about 10 years. And about year 8, I was so burned out in the system where I noticed that 50% of the patients who came in didn't need to be there if they just had good preventative care. And I thought, well, I bet we could teach more people using new technology like YouTube, etc. And so I thought, well, what if I put some videos out with an alter ego, and I'll call him ZDoggMD with 2 G's because 1 G isn't gangster enough. 60 videos later and millions of views, it kind of proved itself that we were actually reaching people where they are, as opposed to having them come to us. So that sort of opened my mind to maybe we should be rethinking how we do medicine in general, focusing on prevention, focusing on being partners with patients instead of this sort of paternalistic relationship with all these outside pressures.
I love kids, so I'm a pediatrician, and I was either going to be a pediatrician or a nursery school teacher. It's so important that we have doctors who are independent and who are not responsible to the institution, because the independent doctor is much more responsible to the patient. The doctor who's employed by the hospital is responsible to the hospital.
You can judge a society most by how it cares about its children. And children are the unsung minority in this country. They don't vote, they don't have resources, they don't often have a voice. So we who have dedicated our lives to pediatrics, I think, deserve special recognition in our society because our children are our future.